Well, to answer that question, we need to understand what a tear trough deformity is. So in short, it's when the skin and soft tissue are adherent or stuck to the orbital rim, and you have fat herniation above the orbit at the same time that you have a descent of the cheek skin and soft tissue. So essentially you get two peaks and one valley. And that valley is the tear trough, and it can give you a very tired look to your face. So the surgical treatment of a tear trough deformity is essentially a blepharoplasty, but it's different. The main goal of this type of blepharoplasty is to take away the two peaks and fill in the valley. So in the first instance, when there isn't too much redundant skin, there are two different techniques that can be used. The first one is fat grafting, where we take fat from your belly, centrifuge it down, and inject it into the valley under the eye. And the second way is to perform a transconjunctival blepharoplasty approach, where we go on the inside of the eyelid and then reposition the fat that's herniated out of the orbit into the tear trough. And that allows for no incisions on the outside of the eyelid. But when there is redundant skin, we have to use an external excision, and that way we can remove some of the excessive skin. And that's typically done right under the eyelashes, so it's also pretty hidden. In that approach, the herniated fat pockets are trimmed, and then they're repositioned into the trough. At the same time, the excessive skin is removed. Finally, a mid-face lift through an incision in the hairline can help lift up the cheek complex at the same time that it releases the skin that's tethered at the orbital rim. So I hope that helps answer some of your questions about tear troughs and how to fix them. Stay tuned for a video on how to fix tear troughs non-surgically. And if you have any other questions about eyelids or any other aspect of facial plastic surgery, email us at info@drundavia.com or check out our website at drundavia.com.